Good day, global citizens. Welcome to another episode of Dr. Fajembola'S Opinion. On this episode, we are going to take you through the nitty-gritty of what you should know about hepatitis B. Today, I have a specialist on board, Miss Ogechukwu MaryAnn Akabuike, who will take us through a beautiful discussion. I've said the party for a beautiful discussion today. So do me the honor to welcome on board Mrs. Ogechukwu Akabuike MaryAnn. Mrs. Ogechukwu, how are you doing today?
Very well, thank you. Thank you for having me, Dr.
Thank you so much for accepting the invitation. Yes. Let's give our audience an overview of our guest researcher's profile. Mrs. Ogechukwu MaryAnn Akabuike is a passionate public health specialist, researcher, and advocate for infectious diseases, cancer prevention and sexual and reproductive health, with a special focus on menstrual health. She currently serves as the research and publication officer at Move Against Cancer Africa and a research fellow with Women in Global Health Nigeria. Mrs. Ogechukwu contributed to Nigeria's public health response through her role as a laboratory scientist at the Nigeria Center for Disease Control and Prevention. She's a member of the Royal Society of Tropical Medicine and Hygiene, a patient advocate member of the European Association of Urology, an athlete member of the Vaccine Impact Modeling Consortium. A groundbreaking research on hepatitis B in Abuja, published in BMC Public Health, continues to inform national dialogue on awareness, screening, and vaccination. Beyond research, she's a teacher, agricultural enthusiast, and voice of hope. Mrs. Ogechukwu is committed to building healthier communities across Africa. Beautiful profile, Mrs. Ogechukwu. Before we dive into the discussion, let's look at what global citizens are saying about hepatitis B, our topic for today. First is from WHO Egypt, where they tweeted that in 2023, Egypt became the first country in the world to achieve the WHO gold tier status on the path to eliminating hepatitis C. By 2025, WHO recognized Egypt as the first country in the Eastern Mediterranean region to reach the regional target for hepatitis B control. The second is from Bloomberg Institute, where they said the Bloomberg Institute focuses on the research of the hepatitis B virus and related diseases, developing diagnostics for early detection and discovering antivirals, immunotherapies, and cures for severe viral diseases. I feel this is good. We need more chemotherapy, especially for hepatitis. The last tweet is from the hot wife, where she said pre-wedding medical tests for couples, genotype tests, blood group tests, HIV tests, hepatitis B and C, STD, fertility tests, possible chronic genetic order, thalassemia tests, and mental health assessment tests. Don't just waste your time on pre-wedding pictures. I feel this is for everyone. I don't know how many people in Nigeria who are getting married are doing hepatitis B tests. The normally genotype match. You don't have HIV, I don't have HIV. Oh yeah, alter. I don't know how many Nigerians really do the hepatitis B test and other tests. So now let's dive into the discussion, Mrs. Akabuike. Why is according to the it's quite a beautiful publication when I read it, and according to the gender distribution from the paper, there were more female respondents than male respondents in the study. And I discovered that you and your team said, like, from the Lagos study, they had predominantly male HIV positive cases. And this could be associated with women having more health-seeking behaviors and also less unprotected sexual activity compared to their male counterparts, and also occupational exposures in men, which are higher than in females. And I feel we can also compare this to other also diseases.
Yeah.
Mrs. Akabuike, how is hepatitis B a global health concern?
But thank you so much for the question. Hepatitis B is actually a global health concern because it has a serious threat to health, being a silent killer. It doesn't have symptoms. Before you realize you have it, most time the liver is almost gone. This actually was the case of my mother, which was what inspired me to advocate for hepatitis, to have passion to talk about it and then go into research about hepatitis B. She's the type that is hardly sick. She hardly goes to hospital. If you hear that she's in the hospital, maybe probably she went for childbirth, and then she suddenly became sick, and we thought it's normal typhoid and malaria. She got treated, she didn't get better. She was referred to a secondary health facility. She didn't respond to treatment, and eventually she was referred to a specially health facility where she was diagnosed of hepatitis B. But at the time, the liver was long gone, and unfortunately we lost her. And I was barely 17 at the time. That was exactly 1 week after my SSC exam. I was so devastated, not not knowing where to start from and all that. And then to think she died of a preventable disease, I was like, I'm going to do the bit I can to make sure that I raise the awareness about hepatitis B. So it's actually a disease of global concern because, like I said previously, it is a silent killer. So we need to be aware. And then, according to WHO, we have about 250 million people living with chronic hepatitis B globally. So the number is huge. And Nigeria has a good percentage of it. And yes, it has vaccine it has a very effective vaccine, but the awareness is very low. Awareness is low, and then there is need to raise awareness so that people can actually embrace it and do the needful to reduce the mortality rate, especially in sub-Saharan Africa. Thank you.
Okay, thank you so much for that starting answer, Mrs. Akabuike. As an healthy individual in Nigeria, now we're talking about hepatitis B. Some people, this will be their first time of hearing it. Some people, they know about it, but they don't really have adequate knowledge on it. How can an healthy individual develop hepatitis B, get infected with hepatitis B?
Yeah, it can actually be transmitted through infected blood and body fluids. If you have contact with an infected person through sexual intercourse, use of a sharp object, and then engage in share infected objects like sharp objects, get involved in a misguided medical procedure or cosmetology, you can actually get exposed to it. And most importantly, through mother to child, prenatal transmission. A woman that is infected with hepatitis B can actually transfer that to her unborn child during childbirth, during delivery. So these are the ways by which persons can actually be transmitted, can actually get the virus.
Thank you so much, Ma, for that. You talked about, in the answer, you talked about mother to child, which is a form of transmission of hepatitis B, and it's called the vertical transmission. In the paper,
Yeah.
one of the terminology that was used was vertical transmission, and I want you to tell our audience the difference between vertical transmission. Although I've already given them an idea. You broke it down and say, well, that's child. Difference between horizontal transmission and vertical transmission of hepatitis B.
So thank you very much for that, Dr. Azeezat. So for vertical transmission, like you already gave a clue, it's transmission that happens between the mother and the child, when the mother passes the virus to her unborn child during the process of delivery. And then we also have a horizontal transmission where you get it through the other means, practices unsafe sex, unprotected sex, when you have sexual intercourse with with an infected person without adequate protection, and also use of sharp objects, and then some medical procedures that one gets infected, can also get infected horizontally. So in summary, for vertical transmission is mother to child. Infected mother passing the virus to her unborn child during childbirth, and then the horizontal transmission, other means like.
Thank you so much for that beautiful answer. Thank you so much for that beautiful answer, Ms. Akabuike. Actually, one of the ways, because most of us who are watching this, assuming most of us who are watching this have ever done mathematics. You know how graph is vertical, horizontal. So vertical
Yeah,
from up to down, meaning
yeah,
genetics from up to down, mother to
yeah,
child. So
yeah,
that's the way you can know, you can remember it. Up to down, mother is older than a child. That's how she
yeah,
can give the child, whether it's hepatitis B, HIV, whatever disease that is transferable from mother to child. That is vertical transmission. Horizontal transmission is down. Now, horizontal transmission is between you and other people. The one you get
yeah,
from work, the one you get from using infected syringe, the one you get from blood transfusion, the one you get from the population, they are the horizontal, that goes horizontally between you and those around you. So I believe everyone understands vertical, hereditary, put it that way, mother to child, horizontal, you and the community. So
yeah.
Ms. Akabuike, what are three things you want Nigerians to know about hepatitis B in Nigeria?
Hepatitis B, from our study, even though we didn't cover much, it was just Abuja, 16 districts in Abuja, which is not a perfect representation of the Nigerian population. But I want you to believe that hepatitis B is still very much around us. The prevalence rate is very high. It's actually hyper endemic in Nigeria. Hepatitis B is hyper endemic in Nigeria. We have about 13 to 14% prevalence rate in Nigeria, and we have the spread more amongst the underaged or young adults, is more in male than in female. Like Dr. Azeezat rightly pointed out at the beginning of the talk, that we have male more exposed to and more predisposed to hepatitis because of their health seeking behavior, and then because of they are exposed as a result of the work they do, and then their attitude towards healthcare. It's their health-seeking behavior is actually poor when compared with women. Women, one or two things, gets you to the health facility. Maybe most of us doing antenatal visit, and then that's where you get to screen, and then if there is any red flag, you can take it up from there. So the prevalence rate is high, is hyper endemic. If we have about 13 to 14% prevalence rate in Nigeria, and it's seen more in a young adult, which can be likened to their health-seeking behavior. They are more active, and they are also sexually active. Their age brackets are more sexually active, and they are also prone to, take up some of the cosmetic procedures like tattoo. You see them, wear tattoos on their body, so they expose themselves to behaviors that predisposes them to getting the virus. And then finally, we'll have is low. The vaccination coverage is actually low. Like from our study, we noticed that a lot of people didn't complete their vaccination dosage. You have about 99% comply to the first dose, but subsequently the number declined to we have about 44% of participants completing their doses. So showing that they don't have full protection. So that actually goes to show that the vaccination coverage, especially among adults, is still very low. So we still need to raise awareness, get people to screen. If you are negative, you go for vaccination. You vaccinate. You don't just do the first one and stop there. You need to go all out to complete the 3 doses. look, like somebody like me, I know I am already informed. It was what killed my mom. So with that knowledge, I had to be proactive about protecting myself and people around my circle of influence. I had to make sure that everyone gets screened and gets vaccinated. And you don't just take the first dose and stop. For you to get full protection, you need to complete the 3 doses. So to summarize, the hepatitis B is hyper-endemic in Nigeria. The prevalence rate is still high. And then secondly, it's seen more in young adults. And then finally, the vaccination coverage, especially for adults, is still very low. So what needs to be done there? Yes, a lot has been done for childhood vaccination. It's been incorporated into the vaccination schedule. We have HIV vaccination for administered within 24 hours of birth. And then we also have the one for 6 weeks and 14 weeks enclosed in the which is part of the component of the pentavalent. So for childhood vaccination, a lot has been done, a lot of success has been recorded, but for adults, we need to still do more, to make sure that hepatitis B is completely eradicated, which is achievable. Thank you.
Thank you so much for that beautiful answer. Sorry on the loss of your mommy, and so rest in perfect peace. I believe Nigerians have gotten the main points they should know about hepatitis B, especially in Nigeria. Mrs. Akabuike, what advice? How can relevant stakeholders increase awareness of hepatitis B in Nigeria?
I believe that the relevant stakeholders has a lot to do. First of all, we have to start by raising awareness. If people are not informed, they are not informed, they are deformed. People need to be empowered with the right information that will enable them make the right health choices. People need to be informed. The awareness has to be amplified. Voices has to be amplified. People need to know that hepatitis B is still very, very much around. Very, very much still circulating within the system. Our Abuja study, just Abuja, the 16 districts in Abuja, we found 140 cases. 130 positive cases in 16 districts in Abuja alone. We didn't cover all of the local government, all of the districts. We found 130 positive cases, and we're able to link 30 to care. So you can imagine if you can have 140 positive cases in this area, you can imagine the danger out there, and people are not aware, and people still live recklessly. They still practice unsafe sex, and they still, mothers are still not, adequately informed. There has to, the appropriate stakeholders has to ensure that there is adequate health education during the antenatal classes. I want to believe this is actually ongoing. A lot has to be done, and their mothers need to be reached, especially the underserved populations, those women that do traditional birth delivery, that give birth at traditional birth centers. They need to be reached. The health education has to be taken down to them so that they will understand the importance of vaccinating their children within 24 hours. And not just that, they too need to be screened so that if they are positive, the necessary measures has to be taken to ensure that there is a break in the transmission chain so that they don't pass it to the unborn child. So a lot has to be done with awareness. People need to be informed. People need to know that hepatitis B is still very much available, and that they need to know the transmission patterns, how they can get it, how it can be transmitted from one person to the other. They also need to know this. And then persons also getting married should also know, because half the time it's all about HIV, but the hepatitis B is also there. So people also need to know about this. Even persons bringing domestic staff to their houses, they need to screen them. Don't just bring a stranger to your home. You need to screen to be sure that they don't have this virus. It will help you to, that's being proactive to ensure that the family is safe. Because you can imagine a domestic help with the hepatitis B, you can imagine the danger she poses. You never can tell, she gets caught in the kitchen, and then you know what that means and all that. So And also the NGOs too had a lot to do too. They need to go out there. I recently attended a conference, international cancer conference organized by NICRAT, and then one of the takeaways is that you don't just screen persons and leave them. That is unethical. So NGOs shouldn't just screen people and leave them. You screen them, make sure you link them to care. We actually did that in our study, but because of paucity of fund, we are unable to reach out to more persons. And we're unable to treat all of the 130. We're able to link 30 to care. And then again, the religious organizations, Nigeria is a very religious country, you will agree with me. So they also have a role to play. You need to sensitize people that come from marriage course. You need to also tell them that this thing exists. During youth conferences and maybe women and men organizations, when they do their meetings, they need to also incorporate hepatitis B awareness in their health talks and all of that. And then, like our study actually started off from the church. If you're interested to know, I belong to a group in the church. We attend to the poorest of the poor in the community. It's called St. Vincent de Paul. So one of our masters, people that we attend to, we call them masters. So one of our masters that we attend to their medical needs, to their physical needs, their education needs, and the rest, and spiritual needs, of course, but more of their physical health and then other needs. So he came, he was actually sick. So we linked him to our hospital. He was diagnosed of hepatitis. We started off the treatment, but unfortunately we lost him. So that was what actually triggered this Abuja study. And then I got involved and I was passionate about it because of my personal experience as well, losing my mom. So how many more persons are we going to lose to hepatitis? So what did we do? When we realized that we didn't just stop there, we had to take it to the next level. What did we do? We had to organize awareness campaign. We started from the church. We didn't just limit it to our locality in Lokogoma. We had to take it to other districts. And then the acceptance was really was commendable. A lot of persons wants us to come to their district and talk about it. And then by that action alone, we're able to reach over 3,000 persons. And you can imagine those 3,000 will also, communicate the information to the people within the circle of influence. And then that way, a lot of people have been reached. So it would be nice to take this, not just to expand the awareness to other states in Nigeria. So we all need to be proactive. So that's bringing the religious bodies into what the stakeholders need to do. So in our church, when we discovered, when we lost one of our masters to hepatitis, we said, you know what? So many persons are actually not aware of this hepatitis. So that was how the awareness campaign started off. And we ended up reaching over 3,000 plus persons. And then more persons were even calling us to come. We partnered with the National Primary Health Development Agency. They supported us with vaccines. When we ran out of vaccines, we even intend to do more to take it to the next level, but vaccines are currently not available. So we need it should be a synergy. The efforts should cut across different stakeholders, the people at the government, the NGOs, and then the religious organizations. So if they all work together to champion the cause of hepatitis awareness, talk about it, amplify voice, let people know that it's still very much aware, and then what they need to do to protect themselves. And I believe if all of this is put to action, it will do us good in actualizing the target to eradicate hepatitis B by 2030. Thank you.
Thank you so much, Ma, for that explaining to us explicitly how everyone can get involved in hepatitis B eradication in Nigeria. And well done for the job you are doing currently in Nigeria on hepatitis B. Mrs. Akabuike, there are myths about every disease, from cancer to HIV, to tuberculosis. And we also have myths about hepatitis B. What are the myths in Nigeria about hepatitis B? And what are the facts about them?
Okay, so for hepatitis B, we have, like you said, there are lots of myths, but I'm going to focus on three. One is that only people who look sick that have hepatitis B. You need to look sick before you know that you have hepatitis B. It is a myth and it is not correct. The fact is that persons that look perfectly okay can actually have hepatitis B. So we need to be very careful. We need to be very careful. You don't just see any healthy looking person and then you get involved sexually with the person without adequate protection. People still look very healthy and they have hepatitis. And I want to believe that my mom, she didn't just, I'm sure she had it a long time ago. She was exposed, but she didn't know. She was still healthy until she was down. And then the challenge is, when you start showing symptoms, a lot of damage must have done. So early detection is actually key. So that's number one myth. People look, you need to look sick before you know you have hepatitis B is a myth. Is not correct. The fact is that healthy people still carry this virus. And the second one is that it's only sexually transmitted. No, it's not sexually transmitted. It's not transmitted only through sex. It can also be transmitted from, like we talked previously, vertical transmission from mother to child during childbirth, and also use of infected sharp objects, unsterilized equipment. If you want to get involved in some cosmetic procedures, you want to do tattoos, ensure that everything is new. So it's not just gotten through sex. It can also be transmitted through mother to child, and also exposing oneself to infected blood and body fluid, sharing needles and corticals. Ladies that go to salon, make sure you buy your own cortical. Don't use the one they gave you in the salon. Just get your own new. Make sure that anything you are using, any sharp object, it's new, that you're not sharing used one. So to reduce transmission through that route. So then the third myth will be one vaccine dose is enough. And some persons are so lazy when it comes to some health behaviors, especially when they feel they are normal, they are okay. So why will I be stressing myself? Nothing is wrong with me. So that explains why we have 99% participants take up the first dose of hepatitis B, and then only 44% completed it. So when they tell you that one dose is complete, adequate enough to give you full protection, is a myth. It's false. It's not correct. The fact is that you need to complete the 3 doses for you to get full protection. Thank you.
Thank you so much for shedding more light on the truth and the fact we should know about hepatitis B in Nigeria. Mrs. Akabuike, there are doses for hepatitis B vaccines, and many people don't know that there are doses. They don't say, okay, you take it once and for life, you understand. What are the factors that affect the non-adherence of the complete vaccination doses, which are 3, to the best of my knowledge? What are the factors that make Nigerians say, okay, I'm taking the first dose, the last 2 doses, if you're free, we are not going to take it? So what factors affect the non-adherence of Nigerians to the complete dosage of vaccination coverage of hepatitis B?
Like I said, I pointed that out in one of the myths: misinformation, inadequate information, and then low awareness. We need to really, that was part of the limitations of our study of what we found out. Then we said that subsequent outreaches, you must amplify, make it sink in. Nigerians are, they don't tend to, grasp information at the first point of communicating it. You need to, repeatedly communicate it for them to grasp it. So low awareness, people need to understand the importance. People need to understand that it's as good as not doing it at all. Not completing it is as good as not going for the first dose in the first place. So misinformation, some persons believe with one is they are okay, after all they are not sick. And then another factor that we encountered in the course of our work was the distance. The distance. Some persons transport logistics. Some persons who gathered in village square, in community event places, some religious organization centers. These are the areas we used. So we also found out that some persons had the transportation challenge to transport themselves and come again. They say, I beg, make I go market. After I'm not sick. They didn't really understand the importance of completing those doses. So that was why they had to prioritize their businesses and their other engagements more than coming to complete their doses. So these are the factors. One, misinformation. Some persons feel that one dose is enough. After all, they are not sick. And secondly, inadequate information. We need to, emphasize and re-emphasize the importance of completing the doses. And then as we are pushing out the information, because we utilize different social media platforms, religious organizations, and then community, what would I call them? Health communicators. These are the channels we use to communicate the information. So we should have, re-emphasize, make it, put more emphasis like we did the very first one. So when we are communicating, because with the second and the third doses, we just send them text messages and then probably just announced it once. So subsequently, we now decided that we won't just send them text messages. We will also utilize the different stakeholders, the different communication channels we use from the beginning, to communicate, make it look as if it's a fresh one, just to, buttress and then re-emphasize the importance of coming for the second and the third doses. So make it look as if it's the first one. The energy we put into the first, creating awareness for the first one, which was the points where we screened and then did the points where we did the health education and the screening. So that very first appointment was health education happened, then screening happened, and then the negative cases were immediately sent for vaccination. So that was why we have high percentage of participants taking up the first doses. But with the second dose, we just sent text messages out. So subsequently, we are not going to rely on only text messages, because some persons maybe must have missed it, or there are no reminders the very morning they are supposed to go. So not everybody has that, how will I put it? Prioritize their health. Not everybody are proactive about things that concerns their health, especially when they feel they are still normal and they are okay. So the energy we put to gather people in the first place, we put that same energy, by utilizing all the channels of communication. When they are to come for the second dose, which is 2 months, and then the 6th month for the third dose. Thank you.
Thank you so much, Ma, for explaining that. I believe everyone has gotten, everyone is ready. Everyone watching this will become proactive about their health, about not just taking the first dose, but completing the entire dosage regimen for hepatitis B vaccination. Mrs. Akabuike, Nigerians are starting NGOs every now and then. And now, thankfully, more NGOs are going into health. And one of the aspects anyone might want to go to is hepatitis B. They listen to this and they're like, okay, I'll start an NGO focused on helping Nigeria eradicate hepatitis B virus. What advice do you have for anyone who wants to start an NGO focused on hepatitis B?
That would be, thank you very much for that question, Dr. Azeezat. So for NGOs, or some persons or individuals trying to go into NGO to champion hepatitis B vaccination. That is actually one of the diseases we promote in my own NGO, the Medius Plus Foundation. So one of the areas that they need to focus, like we started off with, is awareness. The awareness. When you create awareness, then be loud with it, go all out with it, make noise that our life depends on it. So they should first of all go into awareness, get people informed. Have us have avenues for one-on-one, get people to communicate feedback, give them feedback. So that way, they will, with the awareness, then they can now take it to the next level, which is screening. And then, like I told you previously, the cancer conference that I recently attended, they said it's unethical to screen people without linking them to care. So NGOs should not just stop at awareness, they need to also champion screening. We need to identify the positive cases. There are so many of them roaming the streets. There are so many of them out there. I don't know that they have it. And they screen them. They should not just, they say the exact what the person that the speaker said is that it's criminal to screen people without linking them to care, without treating them. So NGOs should champion their cause. They should raise the awareness, not just raise awareness. They should screen, take a step further to screen people. Then the negative cases, they should make sure that they vaccinate them. And then the positive cases, they should try as much as possible to link them to care. Yes, for the positive cases, they have to also do a further diagnostic. It's not just a test kit, RDT, rapid diagnostic test. So with the positive case, you have to subject them to PCR. So, and the PCR is a little bit cost effective. So the NGOs should also champion to ensure that the health insurance covers these tests for those that have access to health. And as a matter of fact, NGOs should drive the cost to make sure that every Nigerian is covered, has health insurance cover. That will go a long way too, because many of these positive cases, they don't, to determine their viral load, you need to subject them to PCR, and PCR is very expensive for some persons. So if they are able to, to get health insurance, it will help them to actually, take the next step of care by assessing their viral load, which will determine the treatment option that will be given to them. So NGOs should also champion this cause. First of all, I said awareness campaign, screening, then the diagnostics for positive cases, the PCR test. NGOs should also champion that, and then finally they should treat them, make sure that they bridge that gap, and also reach out to appropriate stakeholders, the Ministry of Health, and let them for a way to incorporate some of these treatments so that people have access to care. Because a lot of persons, a lot of positive cases, they're out there, they don't have money to do the viral load test, and they are there. So many of them that have engaged in reckless, sexual behavior will be transmitting the virus, and then it still, lives. It's still, it's still a public health threat. Leaving the positive cases to roam the street and the community. So we need to really identify them and then link them to care. When they are treated, is also a way of reducing transmission and then subsequently eradicating the virus completely. So these are the areas. And of course, with the data generated during the course of these activities, it will help them to embark on evidence-based approach of intervention. It will now help them to know where to focus their intervention, their resources. I mean the NGOs. So that will be all for now. Thank you.
Thank you so much, Ma. I believe with platforms like this, will increase the number of people going into NGOs focusing on hepatitis B vaccine eradication, and everyone also listening to this will encourage others who want to start NGOs on what to do, give them the right advice on what to do to have the best impact on Nigerians. So thanks so much, Ma, for explaining that extensively. What are the challenges around hepatitis B vaccination in Nigeria?
So that will be the challenges around
Yeah.
hepatitis B
Hepatitis B elimination in Nigeria.
elimination in Nigeria. Not
Yes.
the challenges around elimination of hepatitis B
Yes, in
elimination.
Nigeria.
Okay. Well, like I said, we are still battling with the vaccine coverage, poor awareness, financial barrier, stigma, and limited access to diagnostics treatment. I've mentioned all of this previously. So I believe if we are proactive about raising the awareness, let people even know. Because I'm very sure that not a lot of persons know that hepatitis B can be transmitted sexually, and then it can also be transmitted through mother, and some women don't even know that they have it, and then some women don't even subject themselves to antenatal. They don't, especially those in underserved populations, women in IDP camps. At the time we tend to forget them. They are also part of the community. They don't know that they need to to be screened of hepatitis B during pregnancy, because that will also guide with the treatment, and then the care that they will be given during the point of delivery. So there is still need for awareness. So low awareness is part of the challenges of eliminating hepatitis B in Nigeria. So we need to raise awareness. Another one is also stigma. Some persons feel that because it's sexually transmitted, if I say I have hepatitis B, they will think I am being promiscuous. You know how it is with HIV, because before a lot of advocates now went into HIV awareness, and we are now creating awareness about other ways that it can be transmitted. It's not just through sexual intercourse. Some persons believe that once they say you have HIV, it means that you are promiscuous or something. So we need to raise awareness so that we can eliminate stigma. And people also need to know that innocent children can also get it through their mom at the point of delivery, and they need to make them to live a long time, lifelong with this virus. So there is need for us to raise awareness. People need to know about this virus, so that, because if you are not informed, you are deformed. So with the right information, people will be able to take the right health choices that will help them, take charge and take care of their health. So apart from raising awareness, the vaccination coverage too, a lot of, like we did with my NGO, a lot of NGOs also need to, go into screening and vaccination campaigns. You go to communities, sensitize them, screen them, and then vaccinate them. You need to go meet them in the communities. Because some persons, due to transport logistics, due to finance, they don't have money. People can barely eat these days, not to talk of, taking care of themselves when they don't have any symptoms. So NGOs need to take it to the communities, take it to the underserved populations, take it to the IDP camps, take it to, to rural settings, take the awareness campaign there. So when we actually raise awareness and then take screenings to people at their doorstep, at very close to them, then utilize religious organizations, because Nigerians are religious people. Anything father say is correct, anything pastor say is correct, anything imam say is correct. So we should utilize these stakeholders in the church to and then religious organizations to ensure that people are properly informed. I can remember when we did our own in our parish, not just Catholics, we have a lot of people that are gathered, Muslims, they all came to our parish for the crowd was so commendable. They all turned out. And then the National Primary Health Development Agency, we collaborated with them. Then they sent us nurses. And then it was a very, it was a very organized and productive campaign, and it was very fruitful. And we really sincerely hope to push it out there, to cover more communities. Do you get? So for us to really eliminate hepatitis completely in Nigeria, all stakeholders must, all hands must be at work. It has to be a collaborative effort. It's not something one person can do, because the vaccines are expensive. So we really need to, to collaborate with the necessary stakeholders and ensure that we did the right things. to make sure that people are vaccinated, because the vaccine is very, very effective. So we can get them to vaccinate, and not just to take the one dose and run away. Encourage them to complete the full vaccination so that they can get full protection. So I want to believe that once this is done, hepatitis B will be on its way of being completely eradicated or reduced drastically in Nigeria. Thank you.
Thank you so much, Ma, for that. I believe everyone now know about the elimination, the challenges faced on elimination of hepatitis B in Nigeria and how they can come in to help improve the elimination targets for hepatitis B in Nigeria, to help phase out hepatitis B in Nigeria. Everyone has a hand to play, and I usually see collaboration at this level. Everyone has a role to play in elimination of hepatitis B in Nigeria. When I was reading the paper, I discovered it's a research done at community level where you had interaction with the community. What challenges do you and other researchers face during the research
Okay, thank you very
at
much for
community
that.
level?
Yeah, so the challenges were actually, stigma based. Some persons were reluctant to show up. They were they didn't really want to, there was some sort of resistance and then reluctance to in coming out. And then we also had the challenge of not getting them to complete that dose. It was a very, huge challenge that we had to sit down to, to address it. Part of the lessons learned, and we're like, going forward, we must make sure that we put as much energy as we put in the very first time to ensure that we disseminate the information properly so that they will come out to complete their dose, because it was part of the study limitations. We are not able to get them to complete the doses. So that was another challenge that we faced. Another one was transport logistics. So many of them were, we took the awareness to the rural areas, but then we didn't go there to do the data collection and then the screening and the vaccination. We had to use a strategic location within the district, maybe like a church or a community square. And then some of them, the place is a little bit far for them, and then they complained about transportation, that they don't have money to come. So maybe subsequently, we might want to mobilize them. We probably factor in getting a transportation, a vehicle that will convey them. It will be on us. The whole idea is to ensure that we get the right things done. So these are the challenges we faced. We had some persons, we are reluctant as a result of stigma. The positive cases, they were not really, forthcoming. We were a little bit withdrawn. And then we also had the challenge with the adequate communication for the subsequent doses. The first outing was awesome, but the subsequent outing for the second and the third doses, we had a decline in the number of participants. But then the stakeholders actually, they played a significant role to ensure that the whole process was seamless. But then maybe without them, the challenges could have been more critical. Thank you.
So thank you so much. It's beautiful to know the challenges you face. That this is actually a question I really ask my guest researchers on this platform. And because I want non-researchers to know that, okay, these are the challenges people face. And next time research is done around you, you should make their lives easier, how you can contribute positively. Lastly, Mrs.
Yeah,
Akabuike.
sorry to cut you. Sorry to cut you. So I just remembered another one. Of course, finance was also a
Oh,
huge challenge. Finance was also a huge challenge. Like I told you, at some point we ran out of vaccines. We couldn't. We exhausted what we were giving by the National Primary Healthcare Agency, the primary healthcare workers that were attached to us. We ran out of vaccines, and then for the positive cases, we were only able to link 30 to care. So we had paucity of funds, which was a very big challenge. We would have actually loved to treat all of the 130 positive cases that we encountered. And then till date, we are still following up with them, doing the little that we can, but then, we weren't able to get them, adequate care. That was also a challenge that we encountered during the course of our work.
Okay, thank you so much for that. And for everyone, how you can come in next time you see there is a research to do. And it's surprising to me that I don't know why researchers really don't do crowdfunding for research in Nigeria,
We,
because it takes a
we
lot of
actually
finances.
we actually do, but
Crowdfunding
it's
exists.
about interest. It's about interest. Nigerians don't really have is who has interest in what you are doing. So, like I've been
Exactly.
trying, as I've been pushing out the papers for international conferences, we've been accepted for oral presentation and all that. So the whole idea is to communicate our findings out to a larger audience, to see who gets interested, and then supports us to to do even more, to reach out to more participants. So that way, we're getting closer to the target, which is eliminating hepatitis B by 2030.
Okay, thank you so much, Ma, for that. Why I asked that question, which I really asked, is for people to see the challenges faced at community level, challenges these researchers face, and also how they can come in, relevant stakeholders, so they can come in to help boost research, because that's one of the reasons for this platform, not just earth literacy, but to help amplify research globally, especially from the global south in countries like Nigeria. So lastly, the question I usually ask lastly to our guest researchers, where do you see the management of hepatitis B in Nigeria in the next decade? The next 10 years, where do you see Nigeria on the management spectrum of hepatitis B?
Thank you so much for that question. So, everything being equal, if all our hands is on decks, and then we all do the right thing, we are proactive about getting the right things done. I want to believe by 2030, hepatitis B will be a thing of the past. It will reduce it to barest minimum. If we are proactive about raising awareness, ensuring that the pregnant women access antenatal care and they attend antenatal classes, and then they are equipped and informed about this virus, and also screened to make sure that the positive cases are taken care of and given adequate care at the point of delivery to protect the unborn child. If we are proactive about doing this, and we are also increase the vaccination coverage for adults, the adult population, and also ensure that the vaccination coverage for the children, for infants I want to believe that they've done a lot with that already. They are proactive about it. The vaccination, infant vaccination they're doing greatly with it. Then they also need to raise vaccination among the adult population, and also champion health education and awareness. So when all of this is done, I want to believe in the next 10 years, hepatitis B will be a thing of the past. We would have succeeded in joining the rest of the global communities in raising the bar in hepatitis B elimination and control. Thank you.
Thank you so much for being optimistic. Sometimes when I ask these questions, my guest researchers are like, I don't know, I don't think we'll be anywhere. But thank you for being optimistic. Of course, you're not able to research. Thank you for being optimistic on where we'll be in the next decade. And I'm also optimistic Nigeria would have improved greatly on the management and also eradication of hepatitis B in Nigeria. So, global citizens, this is a beautiful paper. From the discussion, you can see that this is a beautiful publication. This is an impactful publication. So during the week, we looked at the publication from Mrs. Akabuike, Ogechukwu MaryAnn, and other researchers, and we brought out points you should know about it. To know more, especially for people now in this era that some people don't have great reading culture. This is a great platform for you to know. If I was when I was a medical student, if I had videos like this, I would be so happy. How to see how everything is broken down and easily understandable. So please not just read the paper, watch this videos, share with your friends, share with your colleagues. I don't know why people who had knowledge. I'm not someone who has knowledge, and that's why I bring on guest researchers on board to share their knowledge. So please don't add knowledge, don't add good videos. Some people don't know what word is. Don't keep good things to yourself. Don't keep good videos to yourself. Share with your friends and family. Let everyone get informed. You don't know which year might prevent the next person from having hepatitis B or from getting infected with hepatitis B. So thank you so much, Global Sis, for joining us on this episode of Dr. Fajembola'S Opinion. This is a platform where research meets understanding. Thank you so much, our guest researcher, Mrs. Akabuike MaryAnn Ogechukwu, for spending your time, sharing your expertise, sharing everything with us to make sure we understand this particular publication excellently. Thank you so much. This is a beautiful discussion. I really enjoyed it, and I'm sure our guest researchers enjoyed it as well. Have a great week, everyone.
Thank you so much, Dr.